when you're not yet a physician. I have learned huge amount from my patients. I learn from every single one of my patients, and every single patient presents differently. So, during the course of this course that you're having, you're going to have this unique opportunity to meet with some of these people who are going to spend time with you and talk about those times that were very, very, very difficult for them. And hopefully what has happened to them is that they've gone to the next step and that they are better right now. But I just want you to realize, really realize how special that opportunity is for you. And that you're able to be part of those times of people's lives, and they're willing to allow you in and share it with them. So, I, as a practitioner, have spent most of my career, at least here at Weill Cornell, working with patients that have developed some type of cancer. Cancer, the word cancer brings fear to people. And that's because anytime someone gets a diagnosis of cancer, the reality is this: there's only two numbers in statistics. People always ask me, what's the chance of this? And I almost always say there's only two numbers. There's 0 and 100%. People talk about all these numbers in between, 20% of this, 80%. And I showed you some numbers of this, blah, blah, blah. You saw how quickly I glossed over it. But in the end of cancer, it's either the patient, some of it is, but really in the end, they just want to know, am I going to get to this 100% mark? And it's that journey that's the hard part of it. So we're going to talk today a little bit about the journey, and Jonathan's going to share with us some of that experience, and I want to thank him personally for doing that, because number one, he's not only just like a lovely guy, but he's an awesome patient to take care of. And there are some patients along the way that are just amazing to work with, that you just enjoy spending time with them, and that makes our job so much more fun to do on a daily basis. So I'm going to open the floor to him to share with you his story.
Thank you. And so before I do, first of all, it's great to see all these inspiring young faces. And I would like to acknowledge, usually you hear about the Fab Five. I have the Super Six. It takes a village. It takes a big village to get to where I'm at. And so the 6 of you in the future, I'd like to acknowledge before I tell you a little bit of my journey. And the first person, and it's in order of who I saw first, second, third, fourth, and now my care is obviously with Dr. Schnall. But Dr. Jonathan Aviv, ENT, Dr. Joe McClansky, radiologist, Dr. Bill Perlow, GI, Dr. Coit, surgeon, Dr. Shah, I'm losing track of all these guys, Dr. Shah, my oncologist, and of course, Dr. Schnall, who continues to see me. That's the village. That's who took care of me and got me to this point. So I'm going to tell you a little bit about what happened to me, but understand that you all are the inspiration, and you all, when I look out to you, and I think one day you will be one of those doctors, quite frankly, who gets a patient to this point. That's why you guys are the most inspirational, I think, career choice in the world. So 5 years ago, almost to the day, I had a slight pain, like typical slight pain at 3 in the morning that anybody might have in their stomach area. And I don't know what transpired me to text my buddy, Dr. Jonathan Aviv, but I did at 3 in the morning, and of course, as a doctor, he responded and said, "What's up?" And I said, "I don't feel so great." And he said, "What's wrong? GI problem?" He said, "Well, you should see a doctor." Not me, I'm an ENT, you should probably go see GI. And so I actually went on ZocDoc and found Dr. Perlow. I went back to Dr. Aviv through text and said, "You know this guy?" "Yes, good doctor." Went to Dr. Perlow, and he's like, "What's wrong? You look great." And I was doing yoga and shape, and I don't know, I got this weird pain. So we did 2 diagnostic tests. We did a X-ray and a sonogram, and both were negative. Remember this. So I walked out of the office, and I was like, "Gosh, is there anything else?" So I called him up. I said, "Is there anything else we can do?" He said, "Yeah, we can do an endoscopy if you'd like. If you really want to do it, let's do it." But both were negative. I said, "Let's do it." So the next day I went in and I had an endoscopy. And he was white when I came out of the sedation. And he called me in his office and he said, in all my years of practice, and he's been practicing a long time, "I'm shocked. But you have a tumor in your G junction, and I believe it's cancerous based on the look of it." So, my whole sort of world at 45 years old completely changed because I never knew about cancer hitting me. I was raising capital for cancer companies, biotech companies. I was an investment banker at the time, and it was always the other person out there, not me. And sure enough, we went to Joe McClansky, and the radiology report showed that I had a stage 3 cancer, and there my journey started. And it's tough when you're sitting in this chamber, which is the scan area, and they open the door, and I'll never forget this. And they said, you have cancer. And there I was, isolated in this room, and you just don't know what to do. However, I'm a yogi, and you sort of get your bearings straight, and you said, okay, let's attack it. Let's figure it out. So I quickly called my resources and put together, I think, an A team, and I started in chemotherapy, which was the first line of treatment for what I had. Dr. Manish Shah administered 5 different chemos, and one clinical trial that I was on with Weill Cornell and NIH. Again, don't know which one worked. It was probably the semblance of all of them. But 11 weeks after administering chemotherapy, I was granted the 3 letters that every cancer patient wants to hear, and that's NED, no evidence of disease, 11 weeks after. So I thought I was done, but I wasn't. I then got to see Dr. Coit, Dan Coit, who's a surgeon, who said to me, okay, well, your next step is your removal of your stomach. And I was like, what are you talking about? There's no cancer left. And he said, well, your organ was compromised, and you could play Russian roulette, or we can take your stomach out, and you could live without a stomach. I mean, really? So he said, yeah, you can do it. There'll be adjustments here and there, but you can do it. So I had my stomach taken out, total gastrectomy. So I thought I was done. And then I had complications from surgery. So 3 weeks after, I had a pulmonary embolism, which affects the lung, and it could potentially kill you. And I'm like, did you believe this? I'm cured of cancer, but I could have died from pulmonary embolism. So I got on Lovenox for 6 months. I was giving my shots to get rid of blood clot. 4 weeks after that, I had another pain, and I go quickly to the hospital, and there I have a Peterson's hernia, which is a bowel, twisting of the bowel, which also could kill you. So they reopened me and fixed that. So the body's been through a lot. It was like Humpty Dumpty. But again, through resilience and quite frankly, a lot of Eastern medicine, yoga, acupuncture, green juicing, I just kept battling and kept fighting all these little things that were thrown my way. After all of that, I had more chemotherapy, which was really like a Band-Aid to make sure that there were no exploding cells, and the lymph nodes were clear, but we just wanted to make sure, so we had that done. And so I had everything finished, and then I had my scans biannually for the next 2 years, and then annually for the next 2 years, and now I'm on my 5th year. And March 15th, I have my last scan, and then, as I was telling Dr. Schnull, rear view mirror. And so it was quite a journey, and I guess what I'm here to really impart to you all is that I hope one day, if you have one patient, this is not meant in a narcissistic or egotistical way, but if you have one patient like me that you actually save their life, it makes your profession, done, right? Because I look at this Fab 6, Fab 6, even though it doesn't sound as good, but Fab 6, and I mean, think about that village that created a second life for me, right? So as I call it, I have version 2, and I take everything, I would say before, breathing is so amazing, I mean, we sit in yoga, and sometimes people go to yoga, they're like doing it for the workout, but the truth is, it's about the breath, and if you get the breath right, everything's even better. And I use that analogy because when you breathe in, everything's good, it's all good. Don't worry if you get a B or a C on your test. You're going to get that certificate, medical degree. You're going to become one of those 6, and you're going to save lives. I'm telling you. So don't fret it. be cool, smile, breathe. It's all good. That's my story, and we'll do some Q&A, open it up to you guys, but I just wanted to tell you that I'm really honored. I'm really honored to be here and look at you all, and I am so, so grateful to look at the future of medicine in this four walls, because it's, you guys have touched me deeply, and there's no one in life